Last year in Maine, 716 people were robbed of their lives by drug overdoses. Some advocates and lawmakers feel the right approach is to decriminalize personal possession of illicit drugs, eliminate law enforcement from the equation, and focus on treatment. Multiple bills currently in the legislature seek to steer Maine down that path. Officials in the city of Brewer are sounding the alarm.
It's pretty scary. Yeah. It's pretty scary stuff.
Brewer City Council member Jen Morin is talking about the scene currently unfolding on the other side of the country in Oregon. It's been 2.5 years since the state passed Measure 110, which decriminalized user amounts of hard drugs and sought to redirect tax dollars to pay for recovery services.
So Measure 110 has just been a disaster.
A slew of Oregon stakeholders recently told Brewer officials via Zoom that the law plunged Portland and other parts of the state into an abyss of homelessness, crime increases, and unchecked addiction.
There are tents in my neighborhood on the sidewalks. Homelessness is skyrocketed. Google Portland and the people living under the bridge. I mean, people are tunneling under our infrastructure to create strange housing situations, and it's all drug fueled.
Leaders in Brewer say they're worried those scenes could play out here, too, if certain bills are passed into law. There is a bill in the works to decriminalize the possession of user amounts of hard drugs here in Maine. The language has not yet been finalized. Both LD 1159 and LD 1364 seek to establish safe sites for users to consume drugs procured elsewhere under supervision. Both of those bills also provide immunity from arrest for users and facility staff. Brewer Public Safety Director Jason Moffett argues decriminalization and facilities like the ones proposed will trigger a downward spiral in the community.
You know, they were using in public parks, out in the open, things like that. Needles everywhere. We know that violent crime went up, property crimes went up, child endangerment cases went up, overdoses went up, both fatal and non-fatal. So, I mean, essentially, it's a bad deal all the way around, and we don't want to see that happen here.
At no point do I foresee Brewer authorizing that sort of a facility here.
They also argue that drug use will not be confined to the consumption sites and will spill over into surrounding areas, drug dealing and other often related crimes too, creating a public safety nightmare for residents, a public safety nightmare they won't be enabled to police.
It ignores what the cost to the rest of us is. It ignores the fact that people might not feel safe in their homes or walking down their streets or enjoying public safety. It means that for a vast majority of the population, the message is just suck it up. And it can't be that.
The city of Brewer has gone so far as to pass a resolution openly stating its opposition to decriminalization and harm reduction or safe consumption sites, saying in part, quote, "The Brewer City Council opposes efforts to decriminalize the possession of illicit drugs, measures that would impede law enforcement's ability to interdict crimes, and measures that embolden criminal behavior," end quote. Instead, leaders are pushing for what they call a multi-prong approach, treatment and drug enforcement, saving lives and getting drugs off the streets.
We have to have balance to this. We have to have treatment, we have to have recovery sources, we have to have education, and as much as the proponents for decriminalization won't like to hear this, you need to have law enforcement in the criminal justice system.
It is important to note that we have previously reported specifically on LD 1159 and LD 1364, including why proponents of those bills feel they are viable solutions. We have those links in this story on our website, foxbangor.com. We will also be speaking next week with the author of the decriminalization bill currently being drafted about the reasoning behind it. We will bring you that conversation as well. In studio, Beth Jones, ABC 7 and Fox 22 News. Last week, we told you about the city of Brewer sounding the alarm and taking a firm stance against proposed measures that seek to decriminalize user amounts of illicit drugs. Tonight, we hear from lawmakers on both sides of the issue who are sounding their own alarm, saying they can't wait any longer to address the growing drug crisis here in Maine.
My own cousin died in 2021 of a fatal overdose. That one death is unacceptable to me.
Like many Mainers, the horrors of drug addiction have also personally impacted lawmakers. Representative Lydia Craft's own connection to the issue, along with her work as a licensed clinical social worker, have driven her to draft what she calls a public health response to substance use disorder. She says the state is woefully ill-equipped to deal with the rising need for treatment and recovery services.
So we have 16 counties in our state, and very few of those are currently served by detox and SUD treatment services. And this bill would establish a comprehensive system of 24-hour care, receiving centers, to when folks are ready and asking for treatment, their first step in recovery is getting face-to-face contact in a receiving center, and that's what this public health bill will do.
The bill's language is still being finalized, but what it also does is decriminalize possession of user amounts of illicit drugs, a controversial approach that takes law enforcement out of the equation.
It's certainly well documented that drug addiction leads to crime and can trigger crime, and that other community members can be harmed by crimes related to the drug addiction of others. Do you feel like there's any room for law enforcement, or are you really taking an approach of law enforcement needs to not be part of this conversation anymore?
It's really important that folks who are struggling with a disease have the interventions that are proven and research-based, which we know substance use treatment is. This bill does nothing to talk about any of the other criminal charges around trafficking and furnishing. This is looking at incarceration hasn't worked. We cannot arrest our way out of this epidemic, and in order to do this, we have to try something different.
Republican Senator Brad Farron is also grappling with loss due to addiction. One of the 716 Mainers lost last year to fatal drug overdoses was his beloved daughter, Haley.
Haley bug, that's what we call it. That's sea turtles. She loves sea turtles and loved to read, loved the Red Sox, just the ray of sunshine.
Farron says he and other Republicans are working on a multi-pronged approach to combating addiction. It, too, is still in the works, but he says it includes boosting education and increased services for treatment and recovery.
It's got to be the three-pronged approach. No one's got the smoking bullet. And that's where I talk about coming out of your comfort zone.
But it does not eliminate law enforcement or decriminalize user possession of drugs.
That's a bridge way too far, and decriminalizing it, I can't get to. I'd rather be able to visit Haley in jail than a gravesite.
Representative Laura Supica is co-sponsoring one of the bills that seeks to facilitate safe consumption sites where addicts could consume drugs under supervision.
I think it comes down to what harm reduction is. And you can't help a person recover, you can't help a person in addiction when they're dead. And so you really have to meet people where they're at.
However, Supica doesn't completely rule out the validity of law enforcement's role and recognizes that what may be a solution for some may not work for others.
For some people, when they are arrested and they enter into the court system, and they get into drug court, that system has worked well for them and they've been able to enter into recovery that way. But that is not true for a lot of other people, so we need different ways to address the issue.
What's clear is that there is crucial common ground: saving lives.
Right, we've got to keep people alive, and we have to help them when they are asking for it.
If we're going to make a difference, people have got to step outside of their comfort zones, and we got to have discussions.
Reporting for ABC 7 and Fox 22 News, I'm Beth Jones.